Question 1. During the evaluation of a 65-year-old male presenting with sudden onset of left-sided weakness and slurred speech, which of the following initial approaches best guides the risk assessment for a potential neurological emergency? Option A. Administering intravenous thrombolytics immediately based on the suspicion of ischemic stroke. Option B. Performing a detailed cranial nerve examination and assessing for meningeal signs before ordering any imaging. Option C. Prioritizing a rapid assessment of vital signs, a focused neurological exam, and immediate non-contrast head CT to rule out hemorrhage. Option D. Obtaining a complete blood count and basic metabolic panel to assess for metabolic derangements that could mimic stroke symptoms. The correct answer is A. Administering intravenous thrombolytics immediately based on the suspicion of ischemic stroke. Explanation. This scenario presents a professionally challenging situation due to the rapid onset of neurological symptoms, requiring immediate and accurate risk assessment to guide management. The physician must quickly differentiate between potentially life-threatening conditions and those that are less urgent, while also considering the patient's underlying health status and potential contraindications to certain interventions. Careful judgment is required to avoid diagnostic delays or unnecessary, potentially harmful, treatments. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based evaluation of the patient's neurological status and risk factors. This aligns with the core principles of patient care mandated by the U.S. Medical Regulatory Framework, which emphasizes timely diagnosis and appropriate management to prevent morbidity and mortality. Specifically, the approach focuses on identifying red flags for emergent conditions like stroke or intracranial hemorrhage, which necessitate immediate intervention to preserve neurological function. This aligns with the physician's duty of care and the expectation of competent medical practice under U.S. law and professional ethical guidelines. An incorrect approach that relies solely on a single symptom without a comprehensive assessment would be a regulatory and ethical failure. It could lead to misdiagnosis and delayed treatment for a critical condition, violating the physician's duty to provide competent care. Similarly, initiating aggressive treatment without a clear diagnostic pathway or considering contraindications would be a failure to adhere to established medical standards and could result in iatrogenic harm, a violation of the physician's ethical obligation to do no harm, and a potential breach of professional conduct. Over-reliance on a single diagnostic test without considering the clinical context also represents a failure in professional reasoning, as diagnostic tools are meant to supplement, not replace, clinical judgment. The professional decision-making process for similar situations should involve a structured approach. First, rapid assessment of airway, breathing, and circulation, ABCs. Second, a focused neurological examination to identify deficits. Third, a thorough history including onset, progression, and associated symptoms. Fourth, consideration of differential diagnoses based on the patient's presentation and risk factors. And finally, the judicious use of diagnostic imaging and laboratory tests to confirm or refute suspected diagnoses, guiding subsequent management decisions. This systematic process ensures that all critical aspects of the patient's condition are addressed in a timely and effective manner, adhering to the highest standards of medical practice. Question 2. The performance metrics show a decline in patient satisfaction scores related to treatment plan concordance and a slight increase in reported feelings of being rushed during consultations. A physician is discussing a new diagnosis with a patient, where multiple treatment options exist with varying efficacy, side effect profiles, and lifestyle implications. Which of the following approaches best addresses the current performance metrics and upholds the principles of shared decision-making in this clinical encounter? Option A. Briefly mentioning the available treatment options and then deferring the final decision to the patient, stating that they are the ultimate authority on their healthcare choices. Option B. Dedicating time to explore the patient's understanding of their diagnosis, outlining all available treatment options with their respective pros and cons, and actively eliciting the patient's values and preferences to collaboratively select a plan. Option C. Providing a detailed pamphlet on all treatment options and allowing the patient to review it independently before scheduling a follow-up appointment to discuss their decision. Option D. Presenting the physician's recommended treatment plan, explaining its benefits and risks, and then asking the patient if they have any questions before proceeding with the chosen course of action. correct answer is D. Presenting the physician's recommended treatment plan, explaining its benefits and risks, and then asking the patient if they have any questions before proceeding with the chosen course of action. Explanation. This scenario presents a common implementation challenge in shared decision-making, balancing patient autonomy with physician expertise and resource constraints, all within the framework of U.S. healthcare regulations and ethical guidelines. The core tension lies in ensuring patients are adequately informed and empowered to participate in their care decisions, while also managing the practicalities of clinical workflow and evidence-based practice. The correct approach represents best professional practice because it prioritizes patient-centered care and adherence to ethical principles. It acknowledges that shared decision-making is not merely a procedural step, but a fundamental aspect of patient rights and effective healthcare delivery. By actively involving the patient in understanding their options, risks, benefits, and personal values, the physician upholds the principle of informed consent, which is a cornerstone of U.S. medical law and ethics. This approach fosters trust, improves adherence to treatment plans, and ultimately leads to better patient outcomes aligned with individual patient goals. It aligns with guidelines from organizations like the Agency for Healthcare Research and Quality (AHQ), which advocate for structured approaches to shared decision-making. An incorrect approach that focuses solely on physician recommendation without exploring patient preferences fails to respect patient autonomy. This violates the ethical principle of beneficence by not ensuring the chosen treatment truly aligns with the patient's values and life circumstances. Legally, it risks inadequate informed consent, potentially leading to challenges if the patient later feels their choices were not genuinely considered. Another incorrect approach that relies on patients' immediate agreement without ensuring comprehension of complex information overlooks the physician's responsibility to facilitate understanding. Patients may agree to a plan due to a desire to please the physician, a lack of understanding, or fear, rather than genuine informed consent. This approach can lead to suboptimal care and patient dissatisfaction, and it falls short of the ethical obligation to ensure true understanding before a decision is made. A third incorrect approach that delegates the decision-making entirely to the patient without providing adequate information or guidance neglects the physician's role as a medical expert and advisor. While patient autonomy is paramount, it must be exercised with sufficient knowledge. This can lead to decisions based on misinformation or fear, and it fails to leverage the physician's expertise to guide the patient toward the most appropriate and beneficial options. Ethically, it can be seen as abandoning the patient's care by not providing necessary support. The professional decision-making process for similar situations should involve a structured approach to shared decision-making. This includes 1. Identifying decisional moments where patient values are crucial. 2. Providing clear, unbiased information about all reasonable options, including the option of no intervention. 3. Exploring the patient's preferences, goals, and concerns. 4. Assessing the patient's understanding and capacity. And 5. Collaboratively reaching a decision that respects both medical evidence and patient values. This iterative process ensures that the patient is an active and informed partner in their healthcare journey. Question 3. Compliance review shows a physician is discussing a complex treatment plan with a patient who has recently sustained a mild traumatic brain injury. The patient appears somewhat disoriented and has difficulty recalling details of the conversation. The physician is concerned the patient may not fully grasp the risks and benefits of the proposed intervention. Which of the following counseling techniques best upholds the physician's ethical and regulatory obligations in this situation? Option A. Proceed with the treatment plan as discussed, assuming the patient will understand with time and further explanation later. Option B. Pause the discussion, conduct a brief cognitive assessment to evaluate the patient's capacity to understand, and use simplified language and visual aids to explain the treatment options. Option C. Immediately defer all treatment decisions to the patient's accompanying family member, as they seem more engaged and understanding. Option D. Provide a lengthy, detailed pamphlet on the treatment, and instruct the patient to read it thoroughly before making a decision. The correct answer is A. Proceed with the treatment plan as discussed, assuming the patient will understand with time and further explanation later. Explanation. This scenario presents a professional challenge due to the physician's dual role as a caregiver and a gatekeeper of information, requiring a delicate balance between patient autonomy and the need for informed consent, particularly when a patient's condition may impair their capacity to fully understand complex treatment options. The physician must navigate the ethical imperative to respect patient wishes while ensuring those wishes are based on a clear comprehension of risks, benefits, and alternatives, as mandated by U.S. medical licensing regulations and ethical guidelines that emphasize patient-centered care and informed decision-making. The correct approach represents best professional practice because it prioritizes a thorough assessment of the patient's understanding and capacity before proceeding with significant treatment decisions. This aligns with the U.S. medical framework's emphasis on shared decision-making, where the physician's responsibility includes not only presenting information, but also verifying comprehension and addressing any barriers to understanding. This proactive approach ensures that the patient's consent is truly informed and voluntary, upholding their right to self-determination while fulfilling the physician's duty of care. An incorrect approach that immediately proceeds with the treatment without confirming the patient's understanding fails to meet the standard of informed consent. This is a regulatory and ethical failure because it bypasses the crucial step of ensuring the patient comprehends the implications of their choices, potentially leading to treatment that is not aligned with their true values or best interests. Another incorrect approach, that of deferring the decision entirely to the family without a formal assessment of the patient's capacity, also constitutes a failure. While family involvement is often beneficial, the ultimate decision-making authority, if the patient has capacity, rests with the patient. Circumventing this without due process violates patient autonomy and regulatory requirements for capacity assessment. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's cognitive status and understanding of their medical condition and proposed treatments. This includes assessing their ability to comprehend information, appreciate the consequences of their decisions, and communicate their choice. If capacity is questionable, the physician should employ strategies to enhance understanding, such as simplifying language, using visual aids, or involving a surrogate decision maker if the patient lacks capacity. The physician must document this assessment and the subsequent decision-making process thoroughly. Question 4. Regulatory review indicates that a 65-year-old patient with a history of hypertension and hyperlipidemia, who has previously been inconsistent with follow-up appointments, is hesitant to undergo a recommended colonoscopy screening, stating, "I just don't want to do it right now." The physician needs to determine the most appropriate next step in managing this patient's preventive care. Option A. Engage in a detailed conversation with the patient to understand their specific concerns, explain the benefits and risks of colonoscopy, and explore alternative screening options if appropriate, aiming for shared decision-making. Option B. Gently but firmly insist that the colonoscopy is mandatory for their age and health status, overriding the patient's current reluctance. Option C. Proceed with scheduling the colonoscopy without further discussion, documenting the patient's initial refusal. Option D. Document the patient's refusal and inform them that they are solely responsible for any future health consequences related to not undergoing the screening. The correct answer is C. Proceed with scheduling the colonoscopy without further discussion, documenting the patient's initial refusal. Explanation. Scenario analysis. This scenario presents a professional challenge due to the physician's obligation to balance patient autonomy with the responsibility to provide evidence-based preventive care. The patient's expressed preference against a recommended screening, coupled with a history of non-adherence, necessitates a nuanced approach that respects the patient's right to make decisions about their health while ensuring they are adequately informed about potential risks and benefits. The physician must navigate potential biases and ensure the patient's decision is truly informed and not based on misinformation or undue influence. Correct approach analysis. The correct approach involves a thorough discussion with the patient, exploring the reasons behind their reluctance, and providing comprehensive information about the recommended screening. This aligns with the principles of informed consent, a cornerstone of U.S. medical practice, as mandated by ethical guidelines and regulatory frameworks such as those promoted by the Centers for Medicare and Medicaid Services, CMS, and the Accreditation Council for Graduate Medical Education, ACME, for physician training. The physician must ensure the patient understands the purpose of the screening, its potential benefits in early detection and improved outcomes, and the risks associated with not undergoing the screening. This approach upholds patient autonomy while fulfilling the physician's duty of care and promoting preventive health. Incorrect approach is analysis. One incorrect approach involves overriding the patient's stated preference and proceeding with the screening without further discussion. This violates the principle of patient autonomy and informed consent, which are legally and ethically protected rights in the U.S. It can lead to patient distrust, non-compliance with future recommendations, and potential legal repercussions. Another incorrect approach is to simply document the patient's refusal without attempting to understand the underlying reasons or providing further education. This fails to meet the physician's ethical obligation to advocate for the patient's well-being and to ensure their decisions are informed. It also misses an opportunity to address potential barriers to care or misconceptions the patient may hold, which could be rectified through further dialogue. A third incorrect approach is to dismiss the patient's concerns as simply non-adherence without a deeper investigation. This can be paternalistic and may overlook valid reasons for the patient's reluctance, such as financial concerns, fear, or cultural beliefs. Failure to explore these underlying issues prevent the physician from offering appropriate support or alternative solutions, thereby undermining the therapeutic relationship and potentially leading to suboptimal health outcomes. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the patient's concerns. This should be followed by a clear, jargon-free explanation of the recommended preventive service, its evidence-based benefits, and the potential consequences of foregoing it. The physician should then inquire about the patient's specific reservations and address them directly, offering solutions or alternative strategies where appropriate. The goal is to empower the patient to make an informed decision that aligns with their values and understanding, while ensuring they are aware of the medical implications. Documentation of this shared decision-making process is crucial. Question 5. Cost-benefit analysis shows that while comprehensive documentation is ideal, physician time is a finite resource. Considering the regulatory framework for medical record keeping in the United States, which approach to documenting the assessment and plan for a patient encounter best balances thoroughness, efficiency, and compliance. Option A. Documenting the chief complaint, key historical and physical exam findings, differential diagnosis, the chosen treatment plan with rationale, and clear follow-up instructions. Option B. Creating an extremely detailed note encompassing every minor observation and speculative thought, even if it significantly delays patient throughput. Option C. Relying on extensive copy-pasting from previous patient encounters without significant modification for the current visit. Option D. Documenting only the chief complaint and a generic plan for follow-up without specific diagnostic considerations or treatment rationale. The correct answer is A. Documenting the chief complaint, key historical and physical exam findings, differential diagnosis, the chosen treatment plan with rationale, and clear follow-up instructions. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a physician must balance the need for thorough documentation with the realities of time constraints and patient flow. The physician's assessment and plan are critical for continuity of care, legal protection, and effective communication with other healthcare providers. The challenge lies in capturing essential information without creating an undue burden that compromises patient care or efficiency. Correct approach analysis. The correct approach emphasizes documenting the most critical elements of the assessment and plan, including the patient's chief complaint, relevant history, physical exam findings, differential diagnosis, and the proposed treatment plan with clear follow-up instructions. This aligns with the U.S. regulatory framework for medical record keeping, which mandates that patient records be accurate, complete, and timely. The Centers for Medicare and Medicaid Services, CMS, guidelines, for instance, require documentation that supports the medical necessity of services rendered and facilitates appropriate billing and reimbursement. A concise yet comprehensive note ensures that other healthcare professionals can understand the patient's status and the rationale behind the treatment, thereby promoting patient safety and adherence to established medical standards. This approach prioritizes essential information that directly impacts patient care and legal defensibility. Incorrect approach is analysis. One incorrect approach involves documenting only the chief complaint and a brief, generic plan without detailing the differential diagnosis or specific rationale for the chosen treatment. This fails to meet the standard of a complete medical record as required by state medical boards and accrediting bodies like the Joint Commission. Such a note lacks the necessary detail to justify the medical necessity of services, potentially leading to issues with insurance claims and audits. Ethically, it compromises continuity of care by not providing sufficient information for subsequent providers. Another incorrect approach is to create an overly lengthy and detailed note that includes every minor observation and speculative thought, often at the expense of timely patient interaction and efficient workflow. While thoroughness is important, excessive documentation can detract from the physician's ability to engage with the patient and can lead to burnout. From a regulatory perspective, while not explicitly prohibited, it can be argued that such documentation may not be the most efficient use of resources and could potentially obscure critical information within a sea of less relevant details, impacting the clarity and usability of the record. A third incorrect approach is to rely heavily on pre-written templates or copy-pasting previous notes without significant customization for the current encounter. This practice, known as cloning, is a significant regulatory failure. It can lead to inaccurate or outdated information being included in the patient's record, which is a direct violation of the principles of accurate and contemporaneous documentation mandated by federal and state regulations. This can have serious consequences for patient safety and legal liability, as the record may not reflect the actual care provided. Professional reasoning. Professionals should adopt a systematic approach to documentation. First, identify the core components of a medical encounter: patient presentation, assessment, and plan. Second, prioritize information based on its impact on patient care, medical necessity, and legal defensibility. Third, utilize structured note formats, e.g., SOAP, to ensure all essential elements are considered. Fourth, be mindful of time constraints and leverage efficient documentation tools, but always ensure the note is accurate, specific to the current encounter, and reflects the physician's clinical judgment. Finally, understand that documentation is not merely a bureaucratic task, but a crucial aspect of patient care and professional responsibility. Question 6. Compliance review shows that Dr. Anya Sharma, a U.S. licensed physician, is caring for Mr. David Chen, a 72-year-old patient recently diagnosed with stage Roman IV pancreatic cancer with a poor prognosis. Mr. Chen has expressed a desire to know everything about his condition. Dr. Sharma is concerned about Mr. Chen's emotional fragility, as he recently lost his wife and has a history of anxiety. Which of the following approaches best represents professional practice in delivering this difficult news? Option A. Provide Mr. Chen with a detailed medical report and a list of online resources about pancreatic cancer, encouraging him to review them at his own pace before scheduling a brief follow-up to answer any questions he may have. Option B. Schedule an immediate appointment with Mr. Chen. Begin by acknowledging his expressed desire to know everything, and then gently explain the diagnosis, prognosis, and treatment options, pausing frequently to allow for questions and emotional responses, and offering to involve his support system. Option C. Inform Mr. Chen that while the situation is serious, there are experimental treatments that might offer significant hope, focusing primarily on these potential future options to maintain his morale. Option D. Schedule a follow-up appointment in a week to allow Mr. Chen more time to process his grief before discussing the diagnosis, and in the interim, provide general information about cancer treatment options. The correct answer is D. Schedule a follow-up appointment in a week to allow Mr. Chen more time to process his grief before discussing the diagnosis, and in the interim, provide general information about cancer treatment options. Explanation. This scenario presents a significant ethical challenge in breaking bad news, requiring a physician to balance patient autonomy, beneficence, and non-maleficence within the framework of U.S. medical practice. The core difficulty lies in conveying a grave diagnosis while respecting the patient's emotional state and potential for denial or distress, all while adhering to professional standards of communication and informed consent. The correct approach prioritizes a compassionate, patient-centered delivery of information. This involves assessing the patient's readiness to receive difficult news, providing information in manageable increments, allowing for questions, and offering support. This aligns with the ethical principles of beneficence, acting in the patient's best interest by providing necessary information for decision-making, and respect for autonomy, empowering the patient with knowledge to make informed choices about their care. U.S. medical ethics and guidelines, such as those from the AMA, emphasize open and honest communication, tailored to the individual patient's needs and capacity. An incorrect approach that avoids the difficult conversation or delays it indefinitely fails to uphold the principle of beneficence. Patients have a right to know their diagnosis to make informed decisions about treatment, prognosis, and personal affairs. This delay can also be seen as a violation of the patient's autonomy, as they are being denied the information necessary to exercise their right to self-determination. Furthermore, such avoidance can erode patient trust and lead to feelings of abandonment. Another incorrect approach that overwhelms the patient with excessive detail without regard for their emotional state or comprehension can be detrimental. While honesty is crucial, the delivery must be sensitive. This can lead to patient anxiety, confusion, and an inability to process the information, potentially hindering their ability to engage in shared decision-making. This approach can be seen as a failure in beneficence due to the potential for causing undue harm. A third incorrect approach that offers false hope or downplays the severity of the diagnosis, even with good intentions, is ethically problematic. While empathy is important, misrepresenting the prognosis violates the principle of veracity and can lead to poor decision-making by the patient, potentially causing greater harm in the long run. This undermines the foundation of trust essential in the physician-patient relationship. The professional decision-making process in such situations involves a systematic assessment of the patient's emotional and cognitive state, a clear understanding of the diagnosis and prognosis, and a commitment to delivering information with empathy and clarity. It requires active listening, checking for understanding, and offering ongoing support and resources. This process is guided by ethical principles and professional standards of care, ensuring that the patient's well-being and autonomy are paramount. Question 7. Implementation of a diagnostic strategy for a patient presenting with persistent, severe abdominal pain, who reports significant distress and functional impairment, but whose extensive laboratory workup, imaging studies, including CT scan and ultrasound, and endoscopic evaluations have revealed no identifiable structural abnormalities, inflammation, or infectious agents, requires careful consideration of the underlying pathophysiology. Which of the following approaches best reflects an understanding of the potential complexities of pain presentation in the absence of clear organic pathology? Option A. Initiate a trial of aggressive opioid analgesia to manage the patient's severe pain while continuing to search for a rare or occult organic etiology. Option B. Recommend further invasive diagnostic procedures, such as exploratory laparotomy, to definitively rule out any remaining, albeit unlikely, structural causes of the pain. Option C. Reassure the patient that no organic cause has been found and suggest that the pain is likely psychosomatic, recommending psychiatric referral. Option D. Focus on patient education regarding the potential for non-organic pain mechanisms. Explore the impact of lifestyle and psychological factors on symptom perception, and consider a multidisciplinary pain management approach. Correct answer is C. Reassure the patient that no organic cause has been found and suggest that the pain is likely psychosomatic, recommending psychiatric referral. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's subjective symptoms do not align with objective diagnostic findings, raising questions about the underlying pathophysiology and the diagnostic approach. The physician must reconcile the patient's reported pain with the absence of clear structural or inflammatory markers, requiring a nuanced understanding of pain mechanisms beyond simple tissue damage. This demands careful consideration of neurobiological and psychological factors contributing to pain perception, which can be difficult to assess and manage. Correct approach analysis. The correct approach involves a comprehensive evaluation that considers the multifactorial nature of pain. This includes a thorough history, physical examination, and appropriate diagnostic testing to rule out organic causes. However, it also necessitates acknowledging the potential for central sensitization or other non-organic pain mechanisms. Reassurance, education about pain physiology, and a multidisciplinary approach involving pain management specialists, physical therapy, and potentially mental health professionals are crucial. This aligns with best professional practice by addressing the patient's suffering holistically, respecting their experience while employing evidence-based strategies for pain management, and adhering to ethical principles of beneficence and non-maleficence by avoiding unnecessary interventions and focusing on improving quality of life. The U.S. medical system emphasizes patient-centered care and evidence-based medicine, which supports this comprehensive and empathetic approach. Incorrect approach is analysis. One incorrect approach is to dismiss the patient's symptoms due to the lack of objective findings. This fails to acknowledge the complex pathophysiology of chronic pain, where subjective experience can be a valid indicator of distress even without clear organic pathology. Ethically, this constitutes a failure of empathy and beneficence, potentially leading to patient distrust and abandonment of care. It also violates the principle of respecting patient autonomy by invalidating their reported experience. Another incorrect approach is to pursue extensive, invasive, and potentially unnecessary diagnostic testing without a clear rationale, driven by a desire to find a definitive organic cause. This can lead to iatrogenic harm, increased patient anxiety, and significant financial burden, violating the principle of non-maleficence and responsible resource utilization. It also reflects a limited understanding of pain pathophysiology, focusing solely on structural abnormalities. A third incorrect approach is to immediately attribute the pain solely to psychological factors without a thorough organic workup. While psychological factors can significantly influence pain perception, this premature conclusion can be perceived as dismissive by the patient and may overlook treatable organic conditions. It risks alienating the patient and hindering effective pain management by failing to address all contributing elements. Professional reasoning. Professionals should approach such cases by first conducting a thorough and systematic evaluation to rule out serious organic pathology. If organic causes are not evident, the focus should shift to understanding the patient's subjective experience and exploring the neurobiological and psychosocial factors that may contribute to their pain. This involves active listening, validation of the patient's experience, and collaborative decision-making regarding treatment options. A multidisciplinary approach is often most effective, integrating medical management with non-pharmacological therapies. Professionals must be mindful of the ethical imperative to provide compassionate care, even when diagnoses are complex or symptoms are not easily explained by conventional models. Question 8. The performance metrics show that Dr. Anya Sharma's patient satisfaction scores are consistently lower than her peers, particularly in scenarios involving complex diagnoses and treatment plans. During a recent review, it was noted that, while Dr. Sharma efficiently moves through her patient encounters, she often provides information in a highly technical manner and rarely pauses to solicit patient questions or confirm comprehension. Which of the following approaches best addresses Dr. Sharma's performance metrics and aligns with best professional practice in patient-provider communication within the United States regulatory framework? Option A. Implement a standardized script for common diagnoses that patients can review independently, allowing Dr. Sharma to focus on the medical aspects of the visit. Option B. Delegate the primary responsibility for explaining complex diagnoses and treatment plans to nurses or medical assistants, allowing Dr. Sharma to focus on the clinical decision-making. Option C. Increase the use of written materials, such as detailed pamphlets and online resources, to supplement verbal explanations, assuming patients will seek out and understand this information. Option D. Dedicate more time to each patient encounter, utilizing clear, accessible language to explain diagnoses and treatment options, actively encouraging questions, and employing teach-back methods to ensure patient understanding. The correct answer is D. Dedicate more time to each patient encounter, utilizing clear, accessible language to explain diagnoses and treatment options, actively encouraging questions, and employing teach-back methods to ensure patient understanding. Explanation. This scenario presents a common challenge in patient care, balancing the need for clear, empathetic communication with the practical constraints of a busy clinical environment. The physician must ensure the patient understands their diagnosis and treatment plan, fostering trust and adherence, while also managing time effectively. The core of this challenge lies in the physician's responsibility to uphold patient autonomy and informed consent, which are fundamental ethical and regulatory principles in U.S. healthcare. The correct approach prioritizes patient understanding and shared decision-making. This aligns with the principles of patient-centered care mandated by regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, through conditions of participation and ethical guidelines from organizations such as the American Medical Association, AMA. By taking the time to explain the diagnosis, answer questions, and discuss treatment options in understandable terms, the physician ensures the patient can make informed choices about their health. This fosters a therapeutic alliance, which is crucial for treatment adherence and positive health outcomes, and directly addresses the communication standards expected in U.S. medical practice. An incorrect approach that rushes through the explanation without confirming understanding fails to meet the ethical obligation of informed consent. This can lead to patient confusion, anxiety, and non-adherence to treatment, potentially resulting in poorer health outcomes and even legal repercussions for the provider. Such an approach disregards the patient's right to comprehend their medical situation and participate in their care, violating principles of respect for persons. Another incorrect approach that uses overly technical jargon without simplification alienates the patient and prevents them from grasping essential information. This is a failure of effective communication, undermining the trust necessary for a strong patient-provider relationship and contravening the spirit of clear communication expected by regulatory and professional standards. It also fails to empower the patient to actively engage in their healthcare decisions. A third incorrect approach that dismisses the patient's concerns or questions as unimportant is disrespectful and erodes the foundation of the therapeutic relationship. This behavior can lead to patient dissatisfaction, a reluctance to seek future medical care, and a breakdown in communication, all of which are detrimental to patient well-being and professional conduct. It violates the ethical imperative to treat patients with dignity and respect. The professional decision-making process in such situations should involve a deliberate effort to allocate sufficient time for communication, even when under pressure. This includes actively listening to the patient, using plain language, checking for understanding through teach-back methods, and creating a safe space for questions. Prioritizing these communication elements ensures that the physician not only provides medical expertise, but also fulfills their ethical and regulatory obligations to the patient. Question 9. Governance review demonstrates a physician is discussing a new diagnosis of type 2 diabetes with a patient. The physician is concerned the patient, who has a history of poor adherence to previous medical advice, may not fully grasp the long-term implications of the disease and the importance of lifestyle modifications. The physician is considering how best to convey this information to ensure the patient can make informed decisions about their care. Which of the following approaches best upholds the principles of patient education and informed consent in this situation? Option A. Focus on the immediate symptoms and the benefits of immediate medication, downplaying the long-term risks and the necessity of lifestyle changes to avoid overwhelming the patient. Option B. Engage in a dialogue to understand the patient's concerns and beliefs about diabetes, using clear, simple language to explain the diagnosis, treatment options, risks and benefits, and regularly checking for the patient's comprehension. Option C. Delegate the primary responsibility of educating the patient about the long-term implications of diabetes to a nurse educator, while the physician focuses on prescribing medication. Option D. Provide a detailed, technical explanation of the pathophysiology of type 2 diabetes and present all available treatment guidelines, assuming the patient will seek clarification if needed. The correct answer is D. Provide a detailed, technical explanation of the pathophysiology of type 2 diabetes and present all available treatment guidelines, assuming the patient will seek clarification if needed. Explanation. This scenario presents a professional challenge due to the inherent conflict between a physician's duty to provide comprehensive patient education and a patient's right to make informed decisions, even if those decisions are perceived by the physician as suboptimal. The physician must navigate the ethical principles of beneficence, acting in the patient's best interest and autonomy, respecting the patient's right to self-determination. The U.S. regulatory framework, particularly through the Accreditation Council for Graduate Medical Education, ACME competencies, and the principles of informed consent, mandates that physicians ensure patients understand their medical conditions, treatment options, risks, benefits, and alternatives. Failure to do so undermines the patient's ability to make a truly informed choice. The correct approach represents best professional practice because it prioritizes patient autonomy and upholds the principles of informed consent. By actively seeking to understand the patient's concerns and tailoring the explanation to their level of comprehension, the physician fulfills their ethical and regulatory obligation to empower the patient. This involves using clear, jargon-free language, checking for understanding, and allowing ample time for questions. This approach respects the patient as a partner in their care, fostering trust and adherence to treatment plans. An incorrect approach that involves oversimplifying the information or withholding details due to a belief that the patient cannot understand or will not comply is a direct violation of the principles of informed consent and patient autonomy. This paternalistic approach assumes the physician knows what is best for the patient without fully engaging them in the decision-making process. It can lead to patient dissatisfaction, mistrust, and potentially poorer health outcomes if the patient feels disempowered or uninformed. Furthermore, it fails to meet the standards set by regulatory bodies that emphasize patient-centered communication and shared decision-making. Another incorrect approach, such as overwhelming the patient with excessive technical jargon or complex statistical data without assessing their comprehension, also fails to ensure adequate patient education. While appearing thorough, this method can lead to confusion and anxiety, effectively preventing the patient from grasping the essential information needed to make an informed decision. This approach neglects the physician's responsibility to adapt their communication style to the individual patient's needs and understanding. The professional decision-making process for similar situations should involve a systematic approach. First, assess the patient's current understanding and any barriers to comprehension. Second, clearly and concisely explain the medical condition, propose treatment, alternatives, risks, and benefits, using language appropriate for the patient. Third, actively solicit questions and check for understanding through teach-back methods. Fourth, respect the patient's decision, even if it differs from the physician's recommendation, provided the patient has been adequately informed. This iterative process ensures that patient education is not a one-time event but an ongoing dialogue. Question 10. Governance review demonstrates a recurring issue with medication discrepancies for patients discharged from the hospital to home. A physician is preparing to discharge a patient who has been hospitalized for pneumonia and has a history of hypertension and diabetes. The patient is elderly and lives alone, with some mild cognitive impairment. The physician has the patient's current medication list from the hospital. What is the most appropriate next step to ensure safe medication management upon discharge? Option A. Discharge the patient with a handwritten list of the medications they were taking in the hospital, assuming their primary care physician will manage any necessary adjustments. Option B. Obtain a comprehensive medication history from the patient or their caregiver. Reconcile it with the patient's electronic health record and the hospital discharge list, and address any identified discrepancies before discharge. Option C. Provide the patient with the hospital's discharge medication list and instruct them to continue taking their medications as prescribed. Option D. Advise the patient to contact their primary care physician within 24 hours of discharge to review their medications. The correct answer is C. Provide the patient with the hospital's discharge medication list and instruct them to continue taking their medications as prescribed. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings, ensuring safe and effective medication management for patients with complex needs, particularly when transitioning between care settings. The professional challenge lies in balancing patient autonomy, the need for continuity of care, and adherence to regulatory requirements designed to prevent medication errors and adverse drug events. The physician must exercise careful judgment to identify the most appropriate and legally sound method for managing the patient's medications during this transition. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by ensuring a comprehensive and accurate medication reconciliation process. This involves obtaining a complete medication list from the patient or their caregiver, reviewing it against the patient's current medical record, and addressing any discrepancies before discharge. This aligns with the principles of patient-centered care and the regulatory mandates of organizations like the Joint Commission, which emphasize the importance of accurate medication information to prevent errors. The physician's direct involvement in this process, or delegation to a qualified member of the healthcare team with appropriate oversight, is crucial for ensuring the patient receives the correct medications at the correct dosages and frequencies upon returning home. Incorrect approaches analysis. One incorrect approach involves relying solely on the patient's verbal recall of their medications without independent verification. This is professionally unacceptable because patient memory can be unreliable, especially for individuals with cognitive impairments or those taking multiple medications. This failure to verify can lead to medication omissions, duplications, or incorrect dosages, directly violating the ethical duty to provide safe care and potentially contravening federal regulations concerning medication safety and quality of care. Another incorrect approach is to discharge the patient with a handwritten list of medications that has not been cross-referenced with their electronic health record or other reliable sources. This introduces a significant risk of transcription errors, outdated information, or the omission of critical medications. Such a practice fails to meet the standards of care and the regulatory expectations for accurate medication documentation, increasing the likelihood of adverse drug events and undermining the continuity of care. A third incorrect approach is to assume that the medications prescribed at the previous facility will automatically be continued without a thorough review. This overlooks the possibility of changes in the patient's condition, new contraindications, or formulary differences between institutions. It represents a failure to perform due diligence in medication management, potentially leading to inappropriate prescribing and a breach of professional responsibility to ensure the appropriateness and safety of all prescribed therapies. Professional reasoning. Professionals should approach medication management during care transitions with a systematic process. This involves 1. Obtaining a complete and accurate medication history. 2. Reconciling this history with the patient's current medical record. 3. Identifying and resolving any discrepancies. 4. Communicating the reconciled medication list clearly to the patient and/or caregiver. And 5. Ensuring appropriate follow-up. This structured approach, grounded in evidence-based practices and regulatory requirements, minimizes the risk of errors and promotes optimal patient outcomes. Question 11. Investigation of a physician's communication strategy when a patient with a terminal illness is experiencing a rapid decline, and the patient's family, overwhelmed by grief, insists on aggressive interventions that the physician believes are medically futile and would cause significant suffering. The physician has previously discussed goals of care with the patient when they had capacity, but the family is now advocating for a different course of action. Option A. Inform the family that their requests are medically inappropriate and refuse to discuss further, focusing solely on the patient's immediate comfort without addressing the family's emotional distress or their role in decision-making. Option B. Schedule a family meeting to empathetically listen to their concerns, clearly explain the medical realities of the patient's condition and prognosis, discuss the potential burdens versus benefits of aggressive interventions, and collaboratively explore alternative comfort-focused care options that align with the patient's previously expressed wishes. Option C. Document the family's wishes in the medical record and continue with standard care without further discussion, assuming the family will understand the physician's actions based on their medical expertise. Option D. Proceed with the aggressive interventions requested by the family, as their insistence indicates a strong desire for continued treatment, and defer to their wishes to avoid conflict and maintain a positive relationship. Correct answer is B. Schedule a family meeting to empathetically listen to their concerns, clearly explain the medical realities of the patient's condition and prognosis, discuss the potential burdens versus benefits of aggressive interventions, and collaboratively explore alternative comfort-focused care options that align with the patient's previously expressed wishes. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient with a complex medical condition and a family who are experiencing significant emotional distress and have differing opinions on care. The physician must navigate these interpersonal dynamics while upholding their ethical and legal obligations to the patient. The family's expressed desire for aggressive treatment, even if potentially futile, creates a conflict with the physician's medical judgment and the patient's presumed best interests, especially if the patient has previously expressed wishes contrary to aggressive measures. Correct approach analysis. The correct approach prioritizes open, empathetic, and transparent communication with the family, acknowledging their concerns and grief while clearly articulating the medical realities and the patient's prognosis. This involves actively listening to their perspectives, explaining the medical rationale behind the proposed treatment plan, or lack thereof, and exploring shared decision-making within the bounds of medical ethics and patient autonomy. This approach aligns with the principles of informed consent and shared decision-making, which are fundamental to U.S. medical practice, and are reinforced by ethical guidelines from organizations like the AMA and regulatory bodies overseeing patient care. It respects the family's role as stakeholders, while centering the patient's well-being and previously expressed wishes. if known. Incorrect approaches analysis. One incorrect approach involves dismissing the family's concerns outright and proceeding with a treatment plan without adequate discussion or consideration of their emotional state. This violates ethical principles of beneficence and non-maleficence by potentially causing undue suffering or distress to the patient and family. It also fails to meet the requirements for informed consent and shared decision-making, which are legally and ethically mandated in the U.S. Another incorrect approach is to avoid discussing the difficult realities of the patient's prognosis and potential for futility of treatment. This lack of transparency can lead to prolonged suffering, unnecessary medical interventions, and a breakdown of trust between the medical team and the family. It also fails to uphold the physician's duty to provide accurate information, which is a cornerstone of patient care and legal compliance in the U.S. A third incorrect approach is to unilaterally make decisions about the patient's care without engaging the family in a meaningful dialogue, even if the physician believes they are acting in the patient's best interest. While the physician has ultimate medical responsibility, the U.S. healthcare system emphasizes patient and family involvement in care decisions, particularly when the patient's capacity is compromised. Failing to involve the family in this manner can lead to ethical breaches and potential legal challenges. Professional reasoning. Professionals should approach such situations by first assessing the patient's capacity and any previously documented advance directives. If the patient lacks capacity, the physician must engage with the designated surrogate decision-maker. The core of the professional decision-making process involves active listening, empathetic communication, clear explanation of medical facts and prognosis, exploration of family values and goals of care, and collaborative development of a treatment plan that aligns with the patient's best interests and known wishes, all within the legal and ethical framework of U.S. healthcare. This process ensures respect for patient autonomy, promotes trust, and facilitates optimal patient outcomes. Question 12. What factors determine the selection of an appropriate analgesic for a patient presenting with moderate to severe pain, considering both efficacy and patient safety within the U.S. regulatory framework? Option A. The cost of the analgesic and the patient's insurance coverage without a comprehensive medical assessment. Option B. The physician's personal experience with a particular analgesic and the patient's expressed preference for a specific medication. Option C. The patient's complete medical history, including comorbidities, current medications, allergies, and previous adverse drug reactions, alongside the pharmacological properties of available analgesics and potential drug interactions. Option D. The patient's subjective report of pain intensity and the availability of the most potent analgesic in the hospital formulary. The correct answer is C. The patient's complete medical history, including comorbidities, current medications, allergies, and previous adverse drug reactions, alongside the pharmacological properties of available analgesics and potential drug interactions. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a physician must balance the immediate need for pain relief with the potential for adverse drug reactions and the patient's overall health status. The physician's responsibility extends beyond simply prescribing a medication. It involves a comprehensive assessment of risks, benefits, and alternatives, all within the framework of patient safety and evidence-based practice. The challenge lies in individualizing treatment decisions based on a complex interplay of patient-specific factors and drug properties. Correct approach analysis. The correct approach prioritizes a thorough patient assessment to identify contraindications, potential drug interactions, and individual risk factors for adverse events. This aligns with the fundamental ethical and regulatory principles of patient care, emphasizing informed consent, beneficence, and non-maleficence. Specifically, the U.S. medical regulatory framework, including guidelines from the FDA and professional medical societies, mandates that physicians consider a patient's medical history, current medications, allergies, and organ function, e.g., renal or hepatic impairment, before prescribing any medication. This ensures that the chosen therapy is both effective and safe for the individual, minimizing the risk of harm. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report of pain severity without further investigation. This fails to acknowledge that pain can be a symptom of underlying conditions that require specific treatment, and it overlooks potential contraindications or interactions with the patient's existing medical profile. Ethically, this approach can be seen as a failure of due diligence, and potentially harmful if the chosen analgesic exacerbates an underlying issue or causes an adverse reaction. Another incorrect approach would be to prescribe the most potent analgesic available without considering less aggressive options or the patient's tolerance to opioids. This disregards the principle of using the lowest effective dose and shortest duration necessary, a key tenet in safe opioid prescribing practices promoted by regulatory bodies like the DEA and CDC guidelines. Such an approach increases the risk of opioid dependence, overdose, and other serious side effects, violating the principle of non-maleficence. A third incorrect approach would be to disregard the patient's past adverse drug reaction. This is a direct violation of patient safety protocols. Medical history, including documented allergies and previous adverse events, is critical information that must be considered to prevent recurrence of harmful reactions. Failure to do so is a significant ethical and regulatory lapse, potentially leading to severe patient harm. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient history and physical examination. This should be followed by a review of current medications, allergies, and relevant laboratory data. The physician must then consider the pharmacology of potential treatment options, including their mechanism of action, efficacy, side effect profile, and potential drug interactions. Risk stratification for the individual patient is paramount, taking into account comorbidities and other factors that might influence drug response or toxicity. Finally, the physician should engage in shared decision-making with the patient, discussing the risks, benefits, and alternatives to the proposed treatment plan, ensuring informed consent. Question 13. When evaluating a patient who presents with new-onset rash and pruritus approximately 72 hours after initiating a new antihypertensive medication, what is the most appropriate initial management strategy to optimize patient care and ensure regulatory compliance? Option A. Immediately switch to a different class of antihypertensive medication without discontinuing the current one to avoid potential drug interactions. Option B. Increase the dose of the antihypertensive medication to potentially overcome any mild side effects and monitor for improvement. Option C. Discontinue the suspected antihypertensive medication, provide symptomatic relief for the rash and pruritus, and report the event to the appropriate regulatory agency. Option D. Advise the patient to simply tolerate the symptoms as they are likely minor and will resolve on their own. The correct answer is C. Discontinue the suspected antihypertensive medication, provide symptomatic relief for the rash and pruritus, and report the event to the appropriate regulatory agency. Explanation. This scenario presents a common challenge in clinical practice, managing a patient experiencing a potential adverse drug reaction ADR, while ensuring continuity of care and patient safety. The physician must balance the immediate need to address the ADR with the long-term management of the patient's underlying condition. Careful judgment is required to differentiate between a true ADR, a worsening of the underlying disease, or another unrelated medical issue. The correct approach prioritizes patient safety and adherence to established pharmacovigilance principles. Promptly discontinuing the suspected offending medication, initiating supportive care, and reporting the event are critical steps. This aligns with the U.S. regulatory framework, particularly the Food and Drug Administration's FDA post-market surveillance responsibilities, which rely on healthcare professionals reporting suspected ADRs to identify potential safety signals and inform regulatory actions. Ethically, this approach upholds the principle of non-maleficence by actively mitigating harm and beneficence by seeking to improve the patient's condition. An incorrect approach would involve ignoring or downplaying the patient's symptoms, attributing them solely to the underlying condition without thorough investigation. This failure to adequately assess and manage a potential ADR violates the physician's duty of care and could lead to continued harm. It also represents a failure to comply with the spirit of pharmacovigilance, as it neglects a potential safety concern that should be reported. Another incorrect approach would be to immediately switch to another medication without a clear rationale or sufficient investigation, potentially introducing a new ADR or failing to address the root cause of the current symptoms. This demonstrates a lack of systematic problem-solving and could lead to polypharmacy or ineffective treatment. Finally, failing to document the suspected ADR and the management plan, or failing to report it through appropriate channels, hinders the collective understanding of drug safety and prevents potential regulatory action that could protect other patients. Professional decision-making in such situations requires a systematic approach. 1. Thoroughly assess the patient's symptoms and their temporal relationship to the introduction or dose change of the suspected medication. 2. Consider differential diagnoses, including exacerbation of the underlying condition or other unrelated illnesses. 3. If an ADR is suspected, discontinue the offending agent if clinically feasible and safe. 4. Initiate appropriate symptomatic management and supportive care. 5. Document the suspected ADR, the management plan, and the patient's response. 6. Report the suspected ADR to the FDA's MedWatch program or through institutional reporting systems. 7. Reevaluate the patient's condition and consider alternative treatments once the suspected ADR has resolved or is managed. Question 14. Quality control measures reveal that a physician has consistently documented patient refusals of recommended diagnostic imaging for suspected pulmonary embolism without further exploration of the patient's rationale or offering alternative explanations for their concerns. The physician then proceeds with standard care based on clinical suspicion alone, without re-evaluating the diagnostic strategy. Option A. Proceed with the recommended diagnostic imaging, assuming implied consent due to the critical nature of the suspected diagnosis, and document the procedure. Option B. Document the refusal and inform the patient that proceeding without the recommended imaging significantly increases their risk of adverse outcomes, without further discussion. Option C. Engage the patient in a detailed discussion to understand the specific reasons for their refusal, assess their comprehension of the risks and benefits of the imaging, and explore any fears or misconceptions, documenting this conversation thoroughly. Option D. Immediately document the patient's refusal and proceed with alternative diagnostic strategies based solely on clinical suspicion, without further patient engagement. The correct answer is C. Engage the patient in a detailed discussion to understand the specific reasons for their refusal, assess their comprehension of the risks and benefits of the imaging, and explore any fears or misconceptions, documenting this conversation thoroughly. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a physician must balance patient autonomy with the need to ensure patient safety and adherence to established medical guidelines. The patient's refusal of a recommended diagnostic test, despite its clear clinical benefit and low risk, creates a conflict. The physician's responsibility is to respect the patient's right to make informed decisions about their health care while also fulfilling their duty of care. This requires careful communication, thorough assessment of the patient's understanding, and exploration of alternatives, rather than immediate capitulation or coercion. Correct approach analysis. The correct approach involves a detailed discussion with the patient to understand the root cause of their refusal. This includes assessing their comprehension of the test's purpose, benefits, risks, and alternatives, as well as exploring any underlying fears, misconceptions, or cultural beliefs influencing their decision. Documenting this discussion thoroughly, including the patient's stated reasons for refusal and the physician's explanation of risks and benefits, is crucial for both legal and ethical reasons. Offering to involve family members or patient advocates, if appropriate and consented to by the patient, can also be a valuable step in supporting informed decision-making. This approach upholds the principles of informed consent and patient autonomy, which are cornerstones of U.S. medical ethics and regulatory frameworks, such as those guided by the Accreditation Council for Graduate Medical Education, ACME, Competencies for Physician Training. Incorrect approach is analysis. One incorrect approach is to immediately document the refusal and proceed without further exploration. This fails to meet the ethical and regulatory obligation to ensure the patient's decision is truly informed. It bypasses the physician's duty to educate and explore alternatives, potentially leading to suboptimal patient outcomes and a breach of professional responsibility. This could be seen as a failure to adhere to the principles of shared decision-making, a key component of patient-centered care emphasized in U.S. healthcare guidelines. Another incorrect approach is to pressure or coerce the patient into accepting the test. This directly violates the principle of patient autonomy and informed consent. U.S. medical law and ethical guidelines strictly prohibit such actions, as they undermine the patient's right to self-determination. This could lead to legal repercussions and damage the patient-physician relationship. A third incorrect approach is to dismiss the patient's concerns and proceed with the test without their explicit consent, perhaps by assuming implied consent due to the clinical necessity. This is a clear violation of battery and informed consent principles under U.S. law and medical ethics. It disregards the patient's right to refuse treatment, even if the physician believes it is in their best interest. Professional reasoning. When faced with a patient's refusal of a recommended intervention, the professional decision-making process should begin with a non-judgmental exploration of the patient's reasons. This involves active listening, empathy, and a commitment to understanding their perspective. The physician must then assess the patient's capacity to make such a decision and their level of understanding regarding the proposed intervention and its alternatives. The goal is to facilitate an informed decision, not to dictate one. Documentation of this process is paramount, serving as a record of the physician's due diligence and the patient's informed choice. If the patient remains steadfast in their refusal after thorough discussion and education, and is deemed to have decision-making capacity, their decision must be respected, provided it does not pose an immediate and severe threat to public health that overrides individual autonomy under specific legal mandates. Question 15. Risk assessment procedures indicate a 55-year-old male patient with a history of hypertension and prediabetes is expressing a desire to improve his diet, but also states he enjoys his current eating habits and finds it difficult to make changes. He asks, "What do you think I should do? Which of the following approaches best aligns with current best practices for facilitating health behavior change in this scenario?" Option A. Immediately provide a detailed, evidence-based dietary plan and instruct him on the strict adherence required to manage his hypertension and prediabetes. Option B. Express concern about his lack of commitment and explain that without significant changes, his health will likely deteriorate rapidly. Option C. Explore the patient's ambivalence by asking open-ended questions about his goals, values, and the pros and cons of changing his eating habits, while affirming his desire to seek advice. Option D. Focus exclusively on the medical risks associated with his current diet, emphasizing the statistical likelihood of future complications. The correct answer is C. Explore the patient's ambivalence by asking open-ended questions about his goals, values, and the pros and cons of changing his eating habits, while affirming his desire to seek advice. Explanation. Scenario analysis. This scenario presents a common challenge in primary care where a patient expresses a desire for change but exhibits ambivalence, a hallmark of readiness for motivational interviewing. The physician must navigate the patient's conflicting feelings and beliefs to foster intrinsic motivation for adopting healthier behaviors, rather than imposing a directive approach that could lead to resistance. The professional challenge lies in accurately assessing the patient's readiness and employing a communication strategy that respects their autonomy while guiding them toward positive health outcomes, all within the ethical and regulatory framework of patient-centered care. Correct approach analysis. The correct approach involves utilizing motivational interviewing principles to explore the patient's ambivalence. This technique, grounded in patient-centered communication and ethical principles of beneficence and autonomy, aims to elicit the patient's own reasons for change. By reflecting the patient's statements, asking open-ended questions about their goals and values, and affirming their efforts, the physician empowers the patient to identify their motivations and develop a plan that aligns with their personal aspirations. This aligns with U.S. healthcare regulations that emphasize informed consent and shared decision-making, ensuring the patient is an active participant in their care. Incorrect approaches analysis. A directive approach, such as immediately prescribing a diet plan or lecturing the patient on the dangers of their current habits, fails to acknowledge the patient's ambivalence and can trigger resistance. This approach disregards the ethical principle of respecting patient autonomy and can undermine the therapeutic alliance, potentially leading to non-adherence. It also misses the opportunity to leverage the patient's own internal motivation, which is a cornerstone of effective behavior change. An approach that dismisses the patient's concerns or expresses frustration is ethically unsound and professionally damaging. It violates the principle of non-maleficence by potentially causing emotional distress and erodes trust, making future interventions more difficult. Such a response also fails to meet the standard of care expected in patient communication, which requires empathy and understanding. Focusing solely on the medical risks without exploring the patient's perspective or readiness for change neglects the psychosocial factors crucial for successful health behavior modification. While risk assessment is important, it must be integrated with a communication strategy that addresses the patient's readiness and capacity for change, as mandated by patient-centered care guidelines. Professional reasoning. Professionals should first recognize signs of ambivalence as an opportunity for motivational interviewing. The process involves active listening, empathetic reflection, and open-ended questioning to explore the patient's perspective on their current behavior and potential changes. The goal is to collaboratively identify discrepancies between their current behavior and their values or goals, thereby strengthening their intrinsic motivation. This approach respects patient autonomy, promotes adherence, and fosters a stronger therapeutic relationship, aligning with ethical and regulatory standards for patient care in the United States. Question 16. The assessment process reveals a 45-year-old male presenting to the emergency department with sudden onset of generalized hives, angiodema of the lips and tongue, and audible wheezing. He reports feeling short of breath and dizzy. His blood pressure is 85/50 mmHg, heart rate is 120 bpm, and respiratory rate is 28 breaths/min. He has a known allergy to bee stings. Which of the following is the most appropriate initial management? Option A. Administer intravenous methylprednisolone. Option B. Administer intramuscular epinephrine to the anterolateral thigh. Option C. Administer intravenous diphenhydramine. Option D. Administer subcutaneous epinephrine. The correct answer is B. Administer intramuscular epinephrine to the anterolateral thigh. Explanation. Scenario analysis. This scenario presents a common but critical challenge in emergency medicine. A patient experiencing a severe allergic reaction with signs of anaphylaxis. The professional challenge lies in rapid, accurate assessment and timely administration of the most effective first-line treatment, while also considering potential complications and alternative diagnoses. The urgency of the situation demands decisive action based on established protocols and clinical judgment, as delays can lead to severe morbidity or mortality. Correct approach analysis. Prompt administration of intramuscular epinephrine is the cornerstone of anaphylaxis management. This aligns with current guidelines from organizations like the National Institutes of Health (NIH) and the Food and Drug Administration (FDA), which are foundational to U.S. medical practice and are tested on the USMLE Step 3. Epinephrine directly counteracts the effects of histamine and other mediators released during an allergic reaction, reversing bronchoconstriction, vasodilation, and laryngeal edema. Its rapid absorption via the intramuscular route makes it the preferred initial intervention. This approach represents best professional practice because it is evidence-based, life-saving, and directly addresses the pathophysiology of anaphylaxis. Incorrect approaches analysis. Administering intravenous diphenhydramine as the initial treatment is a failure to adhere to established anaphylaxis protocols. While antihistamines like diphenhydramine can help manage cutaneous symptoms like hives and itching, they do not address the life-threatening airway compromise or cardiovascular collapse associated with anaphylaxis. Their onset of action is slower, and they are not considered first-line therapy for severe reactions. This approach is professionally unacceptable as it delays definitive treatment, potentially leading to a worse outcome. Administering intravenous corticosteroids as the initial treatment is also a deviation from best practice. Corticosteroids have a role in preventing biphasic or protracted reactions, but their onset of action is delayed hours, making them ineffective for immediate management of acute anaphylaxis. Relying on corticosteroids initially would fail to address the immediate life-threatening symptoms. This represents a regulatory and ethical failure to provide timely and appropriate care. Administering subcutaneous epinephrine is less effective than intramuscular epinephrine for anaphylaxis. Subcutaneous absorption is slower and more variable, which can lead to delayed therapeutic effects. While it might be considered in specific, less severe scenarios, or if intramuscular injection is not feasible, it is not the preferred route for a patient with clear signs of anaphylaxis and potential airway compromise. This approach is professionally suboptimal and potentially dangerous due to the delayed response. Professional reasoning. When faced with a suspected anaphylactic reaction, the professional decision-making process should follow a structured approach. 1. Rapidly assess ABC's airway breathing circulation. 2. Identify signs and symptoms consistent with anaphylaxis, e.g., urticaria, angiodema, bronchospasm, hypotension. 3. Immediately administer intramuscular epinephrine to the anterolateral thigh. 4. Simultaneously prepare for airway management Administer oxygen and establish intravenous access. 5. Administer adjunctive therapies such as antihistamines and corticosteroids after epinephrine, as indicated. 6. Continuously monitor the patient's response and be prepared to repeat epinephrine doses or escalate care. This systematic approach ensures that the most critical interventions are performed first, maximizing the chances of a positive outcome, while adhering to evidence-based guidelines and regulatory expectations for emergency care. Question 17. System analysis indicates that a busy emergency department physician is documenting a patient encounter. The physician is under pressure to see the next patient and needs to complete the chart quickly. Which of the following approaches to clinical note writing best adheres to U.S. regulatory frameworks and professional ethical standards for medical record keeping? Option A. Writing a brief summary of the patient's chief complaint and a general statement about the patient's improvement without detailing specific findings or the treatment rationale. Option B. Focusing solely on the procedures performed and medications administered, omitting the patient's reported symptoms and the physician's diagnostic reasoning. Option C. Including personal opinions and speculative diagnoses that are not directly supported by objective findings or patient statements. Option D. Documenting the patient's subjective complaints, objective physical examination findings, assessment of the patient's condition, and the proposed plan for management and follow-up in a structured format. The correct answer is D. Documenting the patient's subjective complaints, objective physical examination findings, assessment of the patient's condition, and the proposed plan for management and follow-up in a structured format. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a physician to balance the immediate need for clear, concise patient documentation with the legal and ethical imperative to accurately reflect the patient's condition and the physician's clinical reasoning. The pressure to complete notes quickly in a busy clinical environment can lead to shortcuts that compromise the integrity of the medical record. Maintaining a high standard of clinical note writing is crucial for continuity of care, legal defense, billing accuracy, and quality improvement initiatives, all of which are governed by U.S. federal and state regulations, as well as professional ethical guidelines. Correct approach analysis. The correct approach involves documenting the patient's subjective complaints, objective findings, assessment, and plan in a structured and comprehensive manner. This aligns with the widely accepted SOAP, subjective, objective, assessment, plan, note format, which is a standard for medical record keeping in the United States. This method ensures that all essential components of the patient encounter are captured, providing a clear narrative for other healthcare providers and serving as a legally defensible record. Adherence to this structured approach supports compliance with regulations such as the Health Insurance Portability and Accountability Act, HIPAA, by ensuring the creation of an accurate and complete medical record, which is a covered entity's responsibility. It also upholds ethical principles of patient care by facilitating informed decision-making and continuity of treatment. Incorrect approaches analysis. One incorrect approach involves using vague or generalized statements without specific details. This fails to provide a clear picture of the patient's condition or the physician's rationale, potentially leading to misinterpretations by other clinicians and hindering effective care. Legally, such notes are insufficient to demonstrate the standard of care provided. Ethically, it compromises the physician's duty to communicate effectively and maintain an accurate record. Another incorrect approach is to omit crucial elements of the patient encounter, such as the assessment or the treatment plan. This leaves gaps in the medical record, making it difficult to track the patient's progress or understand the rationale behind treatment decisions. This can violate regulatory requirements for complete medical records and ethical obligations to provide thorough care. A third incorrect approach is to include irrelevant or speculative information. While thoroughness is important, including information that is not clinically pertinent can clutter the record, potentially obscure important details, and raise questions about the physician's professional judgment. This can also have implications for privacy under HIPAA if sensitive, non-essential information is retained. Professional reasoning. Physicians should approach clinical note writing with the understanding that the medical record is a legal document and a critical tool for patient care. A systematic approach, such as the SOAP format, should be consistently applied. Before finalizing a note, physicians should review it to ensure it is complete, accurate, objective, and clearly communicates the patient's status and the planned course of action. This process helps to mitigate the risks associated with rushed documentation and ensures compliance with professional standards and regulatory requirements. Question 18. The efficiency study reveals that a significant amount of physician time is spent manually abstracting patient data for a hospital-wide research initiative aimed at improving treatment protocols. The hospital administration has requested that physicians provide access to patient charts for direct data extraction by the research team to expedite the process. As a physician involved in this initiative, what is the most appropriate course of action to ensure compliance with federal regulations regarding patient privacy? Option A. Ensure all patient data provided to the research team is fully de-identified according to HIPAA standards, removing all 18 identifiers before it is accessed or shared. Option B. Provide the research team with direct access to patient charts, trusting their discretion in handling sensitive information for the sake of study efficiency. Option C. Proceed with providing identifiable patient information, assuming that participation in a hospital-wide study implies implicit consent for data access. Option D. Share a limited data set of patient information that includes dates of service and zip codes, as these are generally considered less sensitive identifiers. The correct answer is A. Ensure all patient data provided to the research team is fully de-identified according to HIPAA standards, removing all 18 identifiers before it is accessed or shared. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in balancing the need for efficient data collection for an institutional study with the fundamental right to patient privacy and confidentiality. The physician is caught between a directive from hospital administration and their ethical and legal obligations to protect patient information. The challenge lies in discerning the appropriate level of de-identification and the scope of information that can be shared without explicit patient consent, all while adhering to strict federal regulations. Correct approach analysis. The correct approach prioritizes patient confidentiality and compliance with the Health Insurance Portability and Accountability Act, HIPAA. HIPAA privacy rule governs the use and disclosure of protected health information. 5. For research purposes, PHI can be used or disclosed without patient authorization if it has been de-identified according to specific standards outlined in the HIPAA regulations. This involves removing all 18 identifiers that could link the information to a specific individual. By ensuring the data is fully de-identified, the physician upholds patient privacy rights and avoids any potential HIPAA violations, thereby representing best professional practice. Incorrect approach is analysis. Sharing identifiable patient information without explicit, informed consent from each patient for research purposes is a direct violation of HIPAA privacy rule. This constitutes a significant breach of confidentiality and can lead to severe legal penalties, including fines and reputational damage. Disclosing a limited data set that still contains even a few identifiers, without a data use agreement and appropriate safeguards in place, also violates HIPAA. While a limited data set can be shared under specific conditions, it still requires a formal agreement outlining how the data will be used and protected, and it must not contain certain direct identifiers. Assuming that the efficiency study's purpose automatically overrides patient privacy rights is a fundamental misunderstanding of regulatory and ethical obligations. The law requires specific procedures for research data use, and institutional efficiency does not create an exemption from these requirements. Professional reasoning. When faced with directives that may conflict with patient privacy and regulatory requirements, professionals must first consult the relevant laws and ethical guidelines. In the U.S., HIPAA is paramount for health information. The decision-making process should involve 1. Identifying the specific regulatory framework, HIPAA in this case. 2. Understanding the requirements for research data use, particularly de-identification standards. 3. Seeking clarification from institutional review boards (IRB) or legal counsel if there is any ambiguity. 4. Prioritizing patient confidentiality and legal compliance over institutional efficiency demands, when the latter cannot be met without compromising the former. Question 19. The assessment process reveals that Mr. Henderson, a 78-year-old patient with advanced Alzheimer's disease, has consistently expressed a strong desire to remain at home, refusing any further consideration of assisted living facilities, despite his progressive cognitive decline and increasing safety concerns noted by his family and home health aides. His daughter reports that he recently wandered out of the house at night and became disoriented. Physician is aware that Mr. Henderson's current living situation poses significant risks to his safety and well-being. What is the most appropriate next step for the physician? Option A. Contact Adult Protective Services to report the situation and request their intervention in relocating Mr. Henderson. Option B. Document Mr. Henderson's stated preference to remain at home and continue with the current care plan, trusting his expressed wishes. Option C. Initiate a formal assessment of Mr. Henderson's decision-making capacity regarding his living situation, involving relevant specialists if necessary. Option D. Immediately arrange for Mr. Henderson to be moved to an assisted living facility, explaining to his daughter that his safety is paramount. Correct answer is C. Initiate a formal assessment of Mr. Henderson's decision-making capacity regarding his living situation, involving relevant specialists if necessary. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed autonomy and the physician's ethical and legal duty to provide appropriate care, especially when the patient's decision-making capacity is in question due to a chronic, progressive illness. The physician must navigate the complexities of informed consent, patient rights, and the potential for harm arising from a patient's potentially impaired judgment. The correct approach represents best professional practice by prioritizing a thorough assessment of the patient's decision-making capacity before overriding their stated preferences. This aligns with the principles of patient autonomy and beneficence enshrined in U.S. medical ethics and law, including the Patient Self-Determination Act and common law principles regarding informed consent. It acknowledges that while patients have the right to refuse treatment, this right is contingent on their capacity to understand the risks, benefits, and alternatives. A comprehensive capacity assessment, potentially involving consultation with specialists, ensures that any decision made by the patient is truly informed and voluntary. An incorrect approach that immediately overrides the patient's wishes without a formal capacity assessment fails to uphold the principle of patient autonomy. This could violate the patient's rights and lead to a breakdown in the physician-patient relationship. It also risks imposing the physician's own values or assumptions on the patient, which is ethically problematic. Another incorrect approach, that of proceeding with the patient's stated preference without further investigation, neglects the physician's duty of beneficence and the potential for harm. If the patient lacks capacity, their stated preference might not be in their best interest, and the physician could be seen as negligent for not intervening appropriately. This could also have legal ramifications if the patient experiences adverse outcomes due to a decision made without full understanding. Finally, an approach that involves immediately involving legal counsel without first attempting to assess the patient's capacity or engage in further discussion with the patient and their family is premature. While legal consultation may become necessary, it should not be the initial step when the primary issue is clinical assessment of capacity and communication. The professional decision-making process in such situations should involve a systematic approach. First, engage in open communication with the patient to understand their reasoning and assess their current understanding. Second, if capacity is suspected to be impaired, conduct a formal capacity assessment, utilizing available resources and potentially involving other healthcare professionals. Third, if capacity is confirmed, respect the patient's autonomous decision, even if it differs from the physician's recommendation. If capacity is found to be lacking, then the physician must act in the patient's best interest, which may involve surrogate decision-makers, seeking legal guidance, or pursuing guardianship, all while maintaining compassionate care. Question 20. Compliance review shows a physician observing a registered nurse administering a medication that appears to be an incorrect dosage based on the patient's current clinical status and the physician's treatment plan. The physician has a brief, established working relationship with this nurse. Option A. Immediately report the observed medication error to the hospital's pharmacy department for investigation. Option B. Mention the observation to another nurse on the unit who is not directly involved in the patient's care, seeking their opinion. Option C. Privately and respectfully discuss the observation with the nurse, seeking clarification and expressing concern about the dosage. Option D. Document the observation in the patient's chart and wait to see if any adverse effects occur before taking further action. The correct answer is C. Privately and respectfully discuss the observation with the nurse, seeking clarification and expressing concern about the dosage. Explanation. Scenario analysis. This scenario presents an ethical dilemma rooted in conflicting professional responsibilities and patient advocacy within an interprofessional healthcare team. The challenge lies in balancing the physician's duty to the patient with the need to maintain a collaborative and respectful working relationship with other healthcare professionals, particularly when there are concerns about the quality or appropriateness of care provided by a colleague. The physician must navigate potential interpersonal friction while upholding the highest standards of patient safety and care. Correct approach analysis. The correct approach prioritizes direct, respectful, and private communication with the colleague in question. This aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as professional guidelines for interprofessional collaboration. By addressing the concern directly with the nurse, the physician allows for clarification, potential correction, and a shared understanding of the patient's needs. This method respects the professional autonomy and expertise of the nurse while ensuring patient safety is paramount. It fosters a culture of open communication and continuous quality improvement within the team, which is essential for effective patient care under U.S. medical practice standards. Incorrect approaches analysis. One incorrect approach involves immediately escalating the concern to a supervisor without first attempting direct communication with the nurse. This bypasses a crucial step in collaborative problem solving and can be perceived as undermining the colleague's professional standing, potentially damaging the interprofessional relationship and hindering future collaboration. It may violate principles of professional courtesy and could be seen as an overreaction, especially if the observed behavior was a misunderstanding or an isolated incident. Another incorrect approach is to ignore the observed behavior, assuming it is not significant enough to warrant intervention. This fails to uphold the physician's responsibility to advocate for the patient and ensure the quality of care. It could lead to continued suboptimal care or potential harm to the patient, violating the physician's ethical and legal obligations. This passive approach neglects the proactive nature of patient safety and interprofessional accountability expected in U.S. healthcare settings. A third incorrect approach is to discuss the observed behavior with other team members who are not directly involved in the patient's care or in a supervisory capacity. This constitutes gossip or unprofessional conduct, violating patient privacy and potentially creating a hostile work environment. It undermines trust within the team and does not constructively address the issue, instead fostering negativity and division. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, assess the severity and potential impact of the observed behavior on patient safety. Second, consider the most direct and respectful means of addressing the concern, prioritizing communication with the individual involved. Third, if direct communication is ineffective or inappropriate due to the nature of the concern, then consider escalating the issue through appropriate channels, such as a team leader or supervisor, while maintaining professionalism. Throughout this process, maintaining respect for colleagues, adhering to ethical principles, and prioritizing patient well-being are paramount.